So here we're going to go through a primer on general organization of neuroanatomy. Now there is a ton of great details that we're going to learn here, and when we step away we really should have a pretty good understanding of the nervous system. So an overview of neuroanatomy here, three main systems we're going to talk about: the brain, spinal cord and peripheral nervous system, and then the autonomic nervous system. These are the key structures we're going to cover from the brain. So meninges, this outer thick dura mater, it's this leathery covering here that protects the nervous system. Then the leptomeninges, this translucent area here. We can see these arterial fibers for nourishment of the nervous system. And then the cerebrospinal fluid system here, these ventricular system and then the subarachnoid spaces, spinal fluid again protecting and nourishing the nervous system. Cerebral cortex, we can think of this as the train station. This is this outer gray matter region. It looks beige here. This is the train station where the neurons live. And then underneath the white matter here, these are the railway tracks. So this carries information to and from the cerebrum. And we can see this myelin staining making this white matter appear black. This internal capsule here, this is where these descending motor fibers all bundle. So they start within the cerebrum and then they bundle down within the internal capsule. A small little stroke here can knock out a lot of major motor fibers and cause significant deficit. Basal ganglia, this is the engine of the brain here. This is key in Parkinson's disease that we'll learn about. The thalamus, this relay center, all this sensory information comes in, relays from the thalamus, and then splays out to key regions within the brain. This is an axial T2 view with delineation of all of these different structures. You can find this radiographic atlas on the site. It has all the different views and delineations and then naming of microstructures and macrostructures. So the brainstem itself, this is the main power to the brain, key neuronal pools for survival as well as packaging of the tracks as they come in and out of the brain. These are the cranial nerves as they exit the brain, superiorly cranial nerve 2 and then inferiorly cranial nerve 12. The cerebellum for balance and coordination. This is a key learning organ. It adapts really easily. Spinal cord and peripheral nervous system we'll talk about in more detail later, but this is our general organization. Spinal cord and then the nerve roots, plexuses, this inner weaving of these nerve fibers, then the peripheral nerves, neuromuscle junction to muscle, and then we always include the sensory receptor. This is just a helpful localization illustration here. Autonomic nervous system is parasympathetic, is for rest and digestion states, so states of relaxation, and then the sympathetic nervous system, a state of activation, the fight or flight state. So cerebrum essentials, so the brain itself. So the cerebrum lies above the brainstem and cerebellum. These are the cerebral lobes that we'll talk about. Frontal lobe, main cognitive or main functional domains, cognitive function, motor function in this primary motor cortex, and then directionality of eye movements, these frontal eye fields. When we're thinking about the cerebrum, we're thinking about localization. So if a patient presents with weakness, we're thinking anteriorly in the frontal lobe. As well, if they have trouble with directionality of eye movements, again, we're thinking about the frontal lobe. Parietal lobe, sensory and spatial processing. So this is the, quote, where area of the brain. Then the temporal lobe for language and also visual processing, but this is the what area. It's an object recognition area. Then the occipital lobe is the main visual region of the brain. So visual information synapses posteriorly within the occipital lobe and then is passed anteriorly. And so the where area goes to the parietal lobe and then the what something is goes towards the temporal lobe. The limbic lobe for memory and emotional processing, cingulate gyrus, hippocampus, parahippocampal gyrus, all of this is packed within the limbic lobe. This is just gross anatomical view. Again, this is this outer cellular gray matter region and then the white matter pathways underneath it. And then these invaginations, these help delineate various cortical gyri that are named, and there's a detailed anatomy on the website that goes through each of the different cortical gyri. So basal ganglia, thalamus, and limbic system, key brain regions here. Basal ganglia we talked about for motor output. Here's the caudate, putamen lateral to the globus pallidus. Caudate, a major relay center like the thalamus. Then the lentiform nucleus comprises the putamen and globus pallidus, and it's helpful to know that the putamen lies lateral to the globus pallidus. This is our illustration here, just matching this axial view of the brain. And now we include in the thalamus here, and we talked about the internal capsule earlier. This thalamic system, the hypothalamus, many different physiological functions, including pineal gland, melatonin creation and release, and then the pituitary gland has a ton of different hormones that it secretes. Then the thalamus we talked about was this relay center where sensory information synapses within the thalamus and then splays out to the different brain regions. Limbic system, cingulate gyrus for motivation and memory, the hippocampus, this key memory processing center, and then the amygdala, this key emotional center. We can see all of this interconnected in the PAPE circuit here. Brainstem, cerebellum, and cranial nerves. This is just a helpful illustration for top to bottom, midbrain, pons, medulla, and then the organization of the cranial nerves emanating out from the brainstem. Midbrain here, this has these Mickey Mouse ears. So the cerebral peduncles carry these descending motor fibers. The substantia nigra has two divisions, a pars compacta for dopamine. This is in Parkinson's disease, there's loss of these dopaminergic cells. And then the pars reticulata, we'll talk about in detail, these direct and indirect pathways. And then this inspection here, we talked about these Mickey Mouse ears, the crus cerebri, and then this red nucleus is an identifiable structure as well. Key thing from the pons are these pontocerebellar fibers. They're the most identifiable, and there's this whole pathway that interconnects the cerebrum to the pons and the cerebellum for modulation of motor output. Motor output comes from the cerebrum and then gets processed within the cerebellum to smoothen it out. Medulla here, the inferior olives and the medullary pyramids, and we can see these structures over here, the inferior olives. Inferior olives, think climbing fibers, and then the medullary pyramids are an extension of those crus cerebri, and they carry these descending corticospinal tract fibers. Spinal cord, peripheral nervous system. Vertebral column encases the spinal cord, and then the spinal cord connects the brainstem and the peripheral nervous system, and then the peripheral nervous system connects the nervous system to the environment. And then we talk about the autonomic nervous system. Again, parasympathetic, rest and digest, sympathetic, activation, fight or flight. So spinal cord, cervical, thoracic, lumbosacral, coccygeal. We talked about this organization of roots and then this interweaving of nerves into plexi, and then the peripheral nerves, neuromuscle junction to muscle here. This epidural space is really important, and then this region below the spinal cord, but within the vertebral column, called this cauda equina, this horse's tail. This is really key for localization because injury here can cause paraplegia, weakness of the lower extremities. This organization of the spinal cord itself, we can think about white matter tracts, and then we'll talk about these gray matter horns. So from a white matter column standpoint, posteriorly large sensory fibers, laterally corticospinal tract fibers, and then these thinly myelinated, these thin sensory fibers anteriorly. So this anterolateral system of spinal thalamic tract, thinly myelinated, pain, temperature, itch sensation. Posterior columns back here, thickly myelinated, large diameter fibers, 2-point discrimination, joint position sensation, and vibration sensation modality. From a gray matter standpoint, posteriorly, sensory information is encoded, and then in the middle, in the intermediate zone here, autonomic information, and then anteriorly or ventrally is motor information. Posterior root ganglion houses these cell bodies for the sensory system, and then these are the ventral roots, and then they meet up, like we talk about here, to form these plexi and peripheral nerves. Autonomic nervous system, again, sympathetic, states of action, parasympathetic, states of rest, rest and digest. Divisions and signs, this is key for localization in neurology. So we're going to divide the nervous system in this section into a central nervous system, upper motor neuron, peripheral nervous system, lower motor neuron. These are the key structures of the central nervous system. These are the key structures of the peripheral nervous system. And then this is the pattern of injury that we see with central nervous system versus peripheral nervous system injury. What do we mean by that? So for the central nervous system, we have, for instance, a neuron within the cerebral cortex, which we call the upper motor neuron, and then we have its emanating fiber, which lies still within the central nervous system. Coming down here, we can see within the spinal cord. Then, for the peripheral nervous system, the neuron starts here, for instance, in the spinal cord, and then the fiber emanates out peripherally. So how this manifests in injury, for instance in stroke, there's an upper motor neuron pattern. Now that pattern means that muscle tone is spastic, muscle stretch reflexes are brisk or hyperactive, they're too fast, and then there are pathologic reflexes present, such as the Babinski sign, which is an upgoing toe when you scratch the bottom of the foot. In contrast, in peripheral neuropathy, where there's just nerve injury, for instance, manifesting with tingling of the toes and sensory abnormalities in the fingertips and wasting of the musculature in the hands and feet, there is flaccid muscle tone. Muscle stretch reflexes are down, so there's an absence of them, or they're weak. And then there are not pathological reflexes present. So the Babinski sign, for instance, would be absent. Where this gets a little tricky is in a spinal cord injury. So at the level of the injury, there's a lower motor neuron pattern, meaning at that injury, so if we call it C5 level, the biceps reflex is going to be hypoactive because there's a lower motor neuron pattern. Now above the level of injury, everything's going to be normal. But below the level of injury, so for instance in the lumbar region, which is below, the knee reflex is going to be brisk because there's going to be an upper motor neuron pattern for everything below that level of injury. And again, this is really, really fundamental for localization. Finally, orientational terminology. Different planes: superior top, inferior bottom, anterior front, posterior behind. And then we have terminology that we'll talk about when we talk about these diagrams themselves. So in sagittal view, there's a difference between the brain and the brain stem. We'll just go into the brain here. Dorsal, top, think of the dorsal fin of a shark. Ventral, bottom, it's underbelly. Rostral, think beak. And then caudal, think tail. And then I just want to point out the difference between radiographic and anatomic orientational standards. So in radiographic view, in coronal view, the face is front on, whereas in anatomical view, it's like you're looking at the back from behind. Then in axial view, radiographic view, the feet are coming up out at you, whereas in anatomic view, it's the head that's coming up out at you. So in coronal view, this is radiographic right, and then in axial view here, this is radiographic right. And axial view is the standard MRI and CT views that we typically look at brain imaging. So that's a lot of information, but should give you a really good basis for anatomy of the nervous system.